We start with new details tonight on COVID-19 outbreaks in our schools. Maricopa County's health department identifying 9 Valley schools with an outbreak of current cases. It's not a surprise schools are dealing with this, but as we look to keep our kids safe, ABC 15's Claudia Rupsich and our education reporting team are looking to see how public health leaders are working to make sure these don't turn into super spreader events.
Today, we asked public health leaders about the spread of COVID-19 in our schools. We know that parents are worried. We get daily emails from you. When it comes to positive cases in your kids' schools, that's part of the public health reporting process. Lauren and Sterling Cooper both go to elementary schools in Mesa Public Schools. Right now, they're doing modified in-person learning, 2 days in the classrooms, 3 days at home.
Getting some normalcy, getting that schedule back 5 days a week, I think that we're all pretty excited about that.
Maricopa County health officials are working with schools, providing resources on safety measures, how to identify cases, and notifying families if a child has been exposed.
It's a super complicated process, and there's lots of moving pieces to it. And so it's really going to vary. The effectiveness is going to vary from school to school. And quite honestly, a lot of that is going to be tied to the quality of the leadership.
Will Humble, the state's former top public health director, says the response to COVID-19 has varied from school to school, but he says finding cases is a good thing.
What's a bad thing is to have a school not working hard to identify those cases, a school not looking for symptoms. If that's happening, then your school's not going to find cases, and that's bad because that can result in a cascade of spread that ends up jeopardizing in-person instruction.
Schools are required to report 2 or more cases that don't live in the same household to Maricopa County Health and notify the school community within 24 hours of the outbreak. County Health says that allows the department to work with school nurses and administrators to ID additional cases and implement control measures.
We have been hearing increasing concerns from our community members.
State Superintendent Kathy Hoffman said earlier this week that schools should be more transparent and publicly report cases.
It helps to prevent the fear, the uncertainty, the unknowns. It also helps our families to make informed decisions about how comfortable they are with sending their children into school.
If the teachers are doing the right thing with symptom checks, if your school nurse is doing the right kind of testing, everything can be perfect. But if your communication with families is bad, the perception is going to be that it's bad, and you will not be able to achieve the goals that you want to keep the infections down in your school.
County Health offers templates for letters schools can send to parents and staff and specify that if a parent's child was in close contact with the infected person, they will be notified.
I want to know if it happens to be in my kid's school, and definitely if it happens to be in my kid's classroom. If there's been any kind of contact, obviously I want to know about that.
Maricopa County health leaders told me if a student is exposed to COVID-19, they have to stay at home for 14 days regardless of a negative test result. A student can still be infected within that time frame. In Phoenix, I'm Claudia Rupsich, ABC 15 Arizona.